Hi, good day everyone. You're welcome to my YouTube channel, Everything Medical. On today's video, I'll be treating the anatomy of the clavicle, that is the collarbone, or the beauty bone in ladies. Why is a sign of malnutrition in male? Before I dive into this class deeply, we are going to be doing a little bit structural organization of the clavicle in the upper extremity. The clavicle is one of the two middle bones. We have two middle bones in upper limb. We have the clavicle and the scapula. The clavicle is the only middle bone among the two that made a true connection with the upper limb, that made a true connection with the axial skeleton per se. It does not make a false connection, so it articulates truly with the axial skeleton or the sternum. While the scapula is just held in place by a band of muscles at the posterior superior back. So as you can see that this collarbone or the clavicle is essential in prehensile movement of the upper limb. So is the only middle bone that made a true connection with the axial skeleton or the sternum. Okay, let's give a proper concept of the clavicle. So the first outline that we're looking onto is the introduction. What is clavicle? The clavicle is an S-shaped bone that transmits the weight of the upper limb to the axial skeleton. As you can see here, this is my clavicle. Here is my clavicle. We have two clavicle, the right and left clavicle. So it connects the upper limb to the axial skeleton. That is why I said that it made a true connection with the axial skeleton, that is the sternum and the upper limb. The scapula does not make any true connection with the axial skeleton. So it is an S-shaped bone that transmits the weight of the upper limb to the axial skeleton. It can be called the collarbone or the beauty bone in ladies. Why is a sign of malnutrition in male or in guys. So then up to the next that we'll be looking onto is the function of the clavicle. Functions. What are those functions of the clavicle? The clavicle is a very vital bone. It's a very bony structure in the upper limb. Number one function of the clavicle is that the clavicle acts like a strut. It acts like a strut. It acts like a strut. Strut can be called a bar. It acts like a strut or a bar for holding the upper limb far away from the axial skeleton, so that the arm can swing clearly away from the shoulder. That is the number one function of the clavicle. The number two function of the clavicle is that the clavicle transmits the weight of the upper limb or the upper extremities to the axial skeleton. It transmits the weight of the upper limb or the upper extremities to the axial skeleton. The number three function of the clavicle is that the clavicle provides site of attachment of muscle. The clavicle provides site of attachment of muscle. And what are those muscles? As we proceed in this class, I will be disclosing those 6 musculatures that attaches in the clavicle, either insert or originate. So we are done from the functions of the clavicle. Up to the next is the shape of the clavicle. The shape. The clavicle, as I've said earlier, it is S-shaped bone. It is a slightly S-shaped bone or cylindrical shaped bone. So it is a slight S-shaped bony structure. That is the shape of the clavicle. Up the next again is the side termination of the clavicle. This is a bony structure. It has side termination and anatomical side termination. Those side terminations are just like the features that determines the size of the bone, because it's a bony structure. So we have side termination. Before I talk on this side termination, we are going to be discussing two important terms. Number one is convex. Two is concave. This is a very, very vital term in this study of the clavicle. A concave or a convex surface are very, very important in this study. What is a convex surface? A convex surface is an arched or rounded surface, which can be called the Medial surface. So the convex is an arched surface or rounded surface, which can be alternatively called the Medial surface. While the concave surface is a shallow surface or a hollowed surface, which can alternatively be called the female surface. Shallow or hollowed surface. So the convex can be called the male surface, while the concave can be called the female surface. Okay, the number one side termination of the clavicle is that the shaft of this clavicle is slightly cylindrical. As you can see here, the shaft of this clavicle is what? Slightly cylindrical, which means that the medial to third shaft is what? Convex forward. And this is a convex surface. It is arched or rounded. So the medial to third shaft of the clavicle is what? Convex forward. This is the medial to third shaft. Medial to third shaft. While the lateral one third shaft is concave forward. And this is a concave surface. So it is shallowed or hollowed. As you can see here, this is a concave surface. It is hollowed as if it's depressed. There is a depression on it. So that is why the lateral one third shaft is what? Concave forward. It is what? Hollowed or shallowed. While the medial to third shaft is convex forward. It is arched or rounded. So here is the lateral one third. Lateral one third shaft. That is the number one side termination. I repeat, the number one side termination of clavicle is that the shaft of the clavicle is slightly cylindrical, which means that the medial to third shaft is convex forward, while the lateral one third shaft is concave forward. I've given a description defining the surface, the convex forward and the concave forward. The next side termination that we have is the ends of the clavicle. The clavicle have two ends. We have the acromial end, which can be called the lateral end. We have the medial end, which can be called the sternal end. The sternal end. Okay. The second side termination of the clavicle is that the acromial or the lateral end of the clavicle is somewhat flat. As you can see here, it is somewhat flat, while the medial or the sternal end is enlarged or quadrilateral. That is the second side termination of the clavicle. The next side termination of the clavicle is that the inferior surface of the clavicle is longitudinally grooved on its medial to third part. And why is it longitudinally grooved? Because there is a presence of the subclavian groove. And here is the subclavian groove. Subclavian groove. This is the borders, the posterior border, the anterior border, the posterior border, and anterior border. It has as well surfaces. We have disclosed the end. It has an acromial or lateral end. It has a medial or sternal end. That is all about the side determination of the clavicle. Up to the next that we'll be discussing is the peculiarities of the clavicle. The peculiarities of the clavicle are those features that, yes, that is being known of this bony structure. The number one peculiarity of the clavicle is that the clavicle is the only long bone that lies horizontally in the body, not even in upper limb only. It's a general body. It's the only long bone that lies horizontally in the human body. The number two peculiarity of the clavicle is that the clavicle is the only long bone that ossifies membranocartilaginously. It does not only ossify intramembranously, because the medial end of the clavicle does not ossify membranously. It ossifies cartilaginously. That is why we call it a membranocartilaginous ossification. So the clavicle is the only long bone that undergoes a membranocartilaginous ossification. The number three peculiarity of the clavicle is that the clavicle is the only long bone that has two primary centers of ossification and one secondary center. It has what? Two primary centers of ossification and one secondary center. The number three peculiarity of this bony structure is that the clavicle is occasionally pierced by a cutaneous nerve. That is the middle supraclavicular nerve. That is the number four peculiarity of the clavicle. The number five peculiarity of this bony structure is that the clavicle is subcutaneous throughout its extent. That is the superior surface only. It is smooth. You can palpate it. It is palpable. You can palpate it. So it is subcutaneous throughout its extent. The number five peculiarities of this bone is that the clavicle transmits the weight of the upper limb to the what? Axial skeleton. It transmits the weight of the upper limb to the sternum. The sternum represents the axial skeleton, indicating where it forms an articulation or a bony articulation or a bony attachment. So those are the peculiarities of the clavicle. Up to the next that we'll be looking on to is the ends of this bony structure, which is a very, very vital one. The ends. The ends. The ends. The clavicle has two ends. It has two ends. It has the lateral end and medial end. Medial end. The lateral end can be called the acromial end, while the medial end can be called the sternal end. Okay, let's start with the lateral end. Look at the lateral end here, which can be called the acromial end. This lateral end of the clavicle is somewhat flat. It presents an oval facet which articulates with the medial margin of the acromion process of the scapula to form a joint known as the acromioclavicular joint, because it has an oval facet which articulates with the medial margin of the acromion of the scapula to form a joint known as the acromioclavicular joint. So it has what we call an oval facet. An oval facet. What is a facet? A facet is a provision in a bone where bones articulate. So it's a site of provision in a bone where bony structures form an articulation, or a provision in a bony structure where other bones made an articulation. So it is called a facet, or a surface for bony articulation. So that is all about the acromial end. Up the next is the medial or the sternal end. Here is the medial or the sternal end. The medial end of the clavicle is enlarged or quadrilateral. It is enlarged or quadrilateral. It presents a saddle-shaped facet which articulates with the costal facet of the manubrum sterni of the sternum to form a joint known as the sternoclavicular joint. So it has a saddle-shaped facet. A saddle-shaped facet, saddle. A saddle-shaped facet, which does what? Which articulates with the costal facet of the manubrum sterni of the sternum to form a joint known as the sternoclavicular joint. Because the sternum is divided into three compartments, into three bony compartments. The superior one, which is the manubrum sterni, the middle one, which is the body of the sternum, and the inferior one, which is the xiphoid process. But the clavicle made an articulation with the manubrum sterni. Laterally to the jugular notch of the manubrum sterni is the costal facet of the what? Of the clavicle, where it articulates with its sternal end or the medial end. So that is the all about the medial end of the clavicle. Up to the next that we'll be discussing is the shaft of the clavicle. The shaft of the clavicle. The shaft. The shaft of the clavicle is an important area in this bony structure. It's a very, very vital region in this bony structure. The clavicle is divided into two shafts. Recall that the shaft only is cylindrical or it is L-shaped. So the shaft of the clavicle is very, very vital. It is being divided into two. It has, number one is the lateral one-third shaft. The lateral one-third shaft. Number two is the medial two-third shaft. Let's start with the lateral one-third shaft. The lateral one-third shaft of the clavicle is flattened from above downward. It is flattened from above downward. This is the lateral one-third shaft. Here, from here is the lateral one-third shaft. So it is flattened from above downward. That is why it has a slight curvature. So it is flattened from above downward. It presents two surfaces and two borders. Two surfaces and two borders. So the lateral one-third shaft presents two surfaces and two borders. Two surfaces and two borders. Lateral one-third shaft. It has two surfaces, the superior surface, the inferior surface. Now it has two borders, the anterior border and posterior border. We'll start with the surfaces. Recall that we said earlier that the lateral one-third shaft is flattened from above downward. It has surfaces, the superior surface and the inferior surface. The superior surface of the lateral one-third shaft is subcutaneous throughout its entire length. It is subcutaneous, meaning that you can palpate it. It lies at the skin. So it is subcutaneous throughout its entire extent. That is all about the superior surface. The inferior surface of the lateral one-third shaft presents an elevated part known as the conoid tubercle. Conoid tubercle. As you can see, it presents an elevated part known as the conoid tubercle and a ridge known as the trapezius ridge. Trapezius ridge. Okay, the trapezius part and the conoid part forms the part of the coracoclavicular ligament. As you can see here, look at the trapezius part and the conoid part forms the coracoclavicular ligament. The both of them forms the coracoclavicular ligament. That is all about that part. Recall that the conoid tubercle is located on the inferior surface of the lateral one-third shaft. It's located on the inferior surface of the lateral one-third shaft, nearer to the posterior border at the junction of the lateral one-fourth shaft and the medial three-fourth shaft. That is where it is located. While the trapezius ridge extends forward, it extends forward laterally to the conoid tubercle. As you can see here, it is lateral to the conoid tubercle. That is why it has to extend forward laterally to the conoid tubercle. That is the position of the trapezius ridge and the conoid tubercle in respect to the inferior surface of the lateral one-third shaft. So up the next we'll be looking on to is the anterior border. The what? Anterior border. We have talked about the superior surface, the inferior surface. Next is the anterior border. The anterior border of the lateral one-third shaft is concave forward. It is what? Concave forward. And it gives an origin of the deltoid muscle. The deltoid muscle. As you can see here, look at the deltoid muscle. So the anterior border is concave forward, which provides an origin for the attachment of the deltoid muscle. Here is the deltoid muscle. Deltoid muscle. While the posterior border is convex backward, which gives an attachment of the, which gives an site of insertion of the trapezius muscle, because the deltoid muscle originated from the clavicle, while the trapezius muscle is inserted. So the posterior border is convex backward, which gives site of insertion of the trapezius muscle. Trapezius muscle. Recall that we have 6 muscle attachments in clavicle. 4 is originated, while 2 is inserted. As we proceed, I will tell you those ones that originated and those ones that are inserted. So we are done from the lateral one-third shaft. Up the next is the medial two-third shaft. The medial two-third shaft the medial two-third shaft. The medial two-third shaft of the clavicle is cylindrical. It is cylindrical. While the lateral one-third shaft is flattened from above downward. As you can see here, this is the medial two-third shaft. So it is cylindrical. It is cylindrical. It takes almost all the shaft. That is why it is medial two-third, while the lateral is one-third. So the medial two-third shaft has 4 surfaces. It does not have border. The border is ill-defined. It has only surfaces, 4 surfaces. Have the superior surface, the inferior surface, the anterior surface, the posterior surface. These are the surfaces of the medial to third shaft. Okay, the superior surface is smooth and it gives an origin of the clavicular head of the sternocleidomastoid muscle. Look at it here. This muscle is originated in the clavicle on the medial to third shaft. So it gives a clavicular head of the sternocleidomastoid muscle, that is the superior surface. So we write, let's indicate it. The clavicular head of the sternocleidomastoid muscle. Sternocleidomastoid muscle. That is all about the superior surface. While the inferior surface is rough. The inferior surface is rough, but it gives numerous features. The number one feature of this inferior surface is that it gives the site of attachment. It has an oval impression for the attachment of the costoclavicular ligament. An oval impression for the site of attachment of the costoclavicular ligament. Look at the costoclavicular ligament here. Oval impression for attachment of the costoclavicular ligament. Costoclavicular ligament. Same as this one. Costoclavicular ligament. The second feature that you can see on the inferior surface is that it presents the attachment of the subclavius muscle, because the subclavian groove is found on the inferior surface of the medial to third shaft. So it presents an attachment of the subclavius muscle. We have discussed earlier that here is the subclavian groove, which is found mostly on the medial to third shaft on the inferior surface, which is this. So it gives an insertion of the subclavius muscle, because it is only the trapezius muscle and the subclavius muscle are inserted in clavicle, while the rest are originated. So you write, it gives an insertion of the subclavius muscle. Subclavius muscle. The third feature of this inferior surface is that it gives an attachment which is found on the medial margin of the subclavian groove for the attachment of the clavipectoral fascia. It's a very, very strong fascia in the upper limb. So the medial margin of the subclavian groove gives an attachment of the clavipectoral fascia. The clavipectoral fascia. Clavipectoral fascia. Clavipectoral fascia is a very, very strong fascia in upper limb. The next feature of this inferior surface is that laterally to the attachment of the clavipectoral fascia present the nutrient foramen, which transmits the vessels that enters the clavicle. So we have the next one is the nutrient foramen, which is laterally to the attachment of the clavipectoral fascia. The nutrient foramen. We are done from the inferior surface. The next one is the anterior surface. The anterior surface is convex forward. It is convex forward, which gives an attachment of the clavicular head of the B major, that is the pectoralis major muscle. Look at it here. This is the anterior surface. it gives an attachment which is the origin of the clavicular head of the pectoralis major muscle, or the P major. This is the P major, pectoralis major. The P major muscle. That is for the anterior surface. It is convex forward, which gives an origin of the clavicular head of the pectoralis major muscle. Up the next is the posterior surface. The posterior surface is concave backward, which gives an origin of the stenohyoid muscle. Here is the origin of the stenohyoid muscle. Stenohyoid muscle. Laterally to the part of the stenohyoid muscle is related to the anterior boundary of the cervico-axillary canal of the axilla, which presents two features: the trunk of the brachial plexus and the third part of the axillary artery. Those are the two features that you could see on the anterior boundary of the cervico-axillary canal, which is related to the stenohyoid muscle, where it is being originated in the clavicle. That is on the posterior surface of the medial to third shaft of the clavicle. The next in line is the ossification. Ossification of the clavicle. Recall that here is the fibrous capsule of the acromioclavicular joint. The fibrous capsule of AC joint, acromioclavicular joint. The fibrous capsule of acromioclavicular joint. While here as well is the facet or the articular surface of the acromioclavicular joint. All these are the features that you could see on the lateral end of the clavicle. Articular surface or facets of AC joint, acromioclavicular joint, AC joint. Okay, here is the fibrous capsule, the fibrous capsule of the sternoclavicular joint. The fibrous capsule of sternoclavicular joint. Fibrous capsule of sternoclavicular joint, SC joint. That is it. So up to the next that we'll be discussing is the muscle attachment. The muscle attachment. The muscle attachment. The muscle attachment. The clavicle has 6 muscle attachments. 2 is inserted, while 4 is originated. Insertion, originated. So the ones that are inserted is the trapezius and subclavius, while the ones that are originated includes the pectoralis major, the stenohyoid, the deltoid, and the sternocleidomastoid muscle. We have discussed the origin and insertions of this muscle while I was talking about the shaft, as the lateral one-third shaft and the medial two-third shaft. So these are how they are being fashioned in the clavicle. So The next in line is the ligaments. The clavicle has so many ligaments, but we'll be mentioning but a few, the ones that are very, very important. We have the costoclavicular ligament, costoclavicular ligament, interclavicular ligament, coracoclavicular ligament, acromioclavicular ligament, these are some of the ligaments of the clavicle. So up to the next are the joints of the clavicle. The joints, because clavicle is a bone, so it forms an articulation. The joints. The clavicle has three important joints. The acromioclavicular joint, that is between the medial margin of the acromion of the scapula and the oval facet of the lateral end of the clavicle. So up to the next is the sternoclavicular joint. This sternoclavicular joint is between the saddle-shaped facet of the sternal end of the clavicle and the costal surface of the manubrum sterni of the sternum. The next one is a false joint, that is the costoclavicular joint, because the inferior surface of the medial total shaft articulates with the first costal facet, that is the first rib. It articulates with the first rib, so it's not like a true joint. It's the first joint of the clavicle. We call it the costoclavicular joint. Once you hear costa, your mind should go to rib. So costo means rib. So it articulates with the first rib. So costoclavicular joint. Costoclavicular joint. That is all about the joint of the clavicle. The next one we'll be looking on to is the nerve supply. The clavicle is occasionally pierced by a cutaneous branch of a nerve known as the middle supraclavicular nerve. The middle supraclavicular nerve. Okay. The next outline is the ossification, because a bone must form. All bone in the body forms. The next one is the ossification of the clavicle. Ossification. Ossification simply means bone formation. It means bone formation, because a bone must form in the intrauterine life before the postnatal life. Okay, what are the ossification of clavicle? The clavicle has two primary centers of ossification and one secondary center. Some authorities will tell you that it have two secondary center, while some will tell you that it have one secondary center. Okay, it has two primary centers of ossification. Two primary center of ossification and one secondary center. The ossification of clavicle, all the clavicle ossifies intramembranously, except the medial end of the clavicle that ossifies cartilaginously. Let me add to the peculiarities of the clavicle. The clavicle is the only long bone that has no medullary cavity. It has no medullary cavity. So add it to the peculiarities of the clavicle. Okay, the primary centers ossifies. It appears the primary center, the primary center, the primary center it appears from 5th to 6th week of IUL, that is intrauterine life. 5th to 6th week of IUL. IUL simply means intrauterine life. Intrauterine life. It appears between 5th to 6th week of IUL and fuses at 45 days of IUL. And fuses at 45 days of IUL. Okay, the secondary center it appears from 16th to 17th years. It appears between 15th to 17th years and fuses between 21 to 22 years. So it appears between 15th to 17th years and fuses at 21 to 22 years. So these are the ossification of clavicle. So the next outline that we'll be looking onto is the clinical and applied anatomy. The clinical correlations of clavicle. The clinical correlation. The clinical correlation of clavicle, which is a very, very vital one. Okay, number one is fracture. It's a bony structure, so it must fracture, it must break. This fracture means bone breakage. One is fracture. Fracture. The clavicle fractures at the site of curvature, at the junction between the lateral 1/3 and the medial 2/3 shaft. So it fractures at the shaft, at the site of the curvature. That is the junction between the lateral 1/3 and the medial 2/3. So it fractures here. This clavicle fractures almost at an outstretched action. So, or from a fall. So it fractures at the site of the curvature between the lateral 1/3 shaft and the medial 2/3 shaft. Up to the next is the clavicular dysostosis. Clavicular dysostosis. It is a clinical condition whereby the medial and the lateral end of the clavicle remain separated due to the non-union of the two primary centers of the clavicle. That is what we call the clavicular dysostosis. It's a condition whereby the medial and the lateral end of the clavicle remain separated due to the non-union of the two primary centers of the clavicle. That is what we mean clavicular dysostosis. So the next one is cleidocranial dysostosis. Cleidocranial dysostosis. This is a clinical anomaly or a developmental anomaly whereby the clavicle is poorly developed or imperfectly formed or absent, thereby the two shoulders being approximated anteriorly towards the chest wall. It's a condition whereby there is no clavicle. it will lead to the two shoulders being approximated anteriorly to the chest wall. So we call it cleidocranial dysostosis, whereby the clavicle is poorly formed or absent, causing the two shoulders to be approximated anteriorly towards the chest wall. That is what we call cleidocranial dysostosis. The next one that we'll be looking on to is osteoarthritis, because it has a joint. The joint of the clavicle could get inflamed. So it could be the inflammation of the joint of the clavicle. We call it the osteoarthritis. We could have osteomalacia. We could have osteoporosis. We could have bone carcinoma or bone CA. There are numerous clinical anomalies that are associated with the bony structure. So I believe we have done justice to the anatomy of the clavicle. We have demystified these bony structures and we have done justice to it. I believe you enjoyed this class. If you have any question, kindly comment it or write it on the comment section and share this video and subscribe as well. Thank you for watching.